Hello, my name is Monica Cramer. I'm a high school student. I did research at Stony Brook University Hospital. I would like to thank the SAGES Program Committee for allowing me to present here today. All right. I have nothing relevant to disclose. So utilization of robotics for inguinal hernia repair is steadily increasing. However, there is a lack of data supporting the widespread adoption of it. In general surgery, general surgery has been one of the slower fields to adopt robotics when compared to other subspecialties like urology and gynecology. Following IRB and Department of Health approval, the New York Statewide Planning and Research Cooperative System, or SPARCS, the longitudinal administrative database, was used to identify all patients between 2010 and 2013 undergoing robotic and laparoscopic femoral or inguinal hernia repair. ICD-9 and CPT codes were used to get this information. This database includes all outpatient and inpatient records for patients who underwent robotic and laparoscopic hernia repair in New York. The SPARCS database provided information about patient demographics, comorbid conditions, hospital and surgeon volume, hospital length of stay, perioperative complications, and 30-day readmission and ED utilization. In terms of statistical analysis, chi-squared tests were used to compare unadjusted marginal differences between, for categorical variables. Welch's ANOVA and non-parametric tests compared unadjusted marginal differences for continuous variables. And propensity score analysis was used to estimate marginal differences and was used to mitigate differences within the population used for the study. The p-values less than 0.05 were considered significant. Our univariate analysis indicated that there were that 98.6% of all of the inguinal hernia repair procedures were laparoscopic, and that was 19,393 patients, whereas there were only 284 robotic procedures, which was 1.4% of the population. 37 institutions were used in this. The median number of operations for each institution was 3, and the range was anywhere from 1 to 51 procedures for each institution. Our initial univariate analysis indicated that patients who underwent robotic assisted inguinal hernia repair had substantially more complications, more 30-day readmissions, 30-day ED visits, and longer hospital lengths of stay. The majority of robotic complications were digestive, intestinal, or due to surgical error, and the same complications were most common for the laparoscopic patients. According to the propensity score matching analysis, patients who underwent robotic-assisted hernia or laparoscopic procedures did not have significant difference in terms of clinical outcomes, which were 30-day readmission, 30-day ED visits, hospital lengths of stay, or any complication. Among the 218 matched pairs of patients, 23 who underwent robotic-assisted surgery had at least one 30-day ED revisit, while their matched pairs didn't. 13 patients who underwent robotic-assisted surgery didn't have any 30-day ED revisits, whereas their matched pairs did. Among the 218 matched pairs of patients, 19 patients who underwent robotic-assisted surgery did not have any complications, while their matched patients did. As well as looking at robotic and laparoscopic, we also looked at hospital and surgeon volume. There was no significant difference between robotic and between the surgeon volumes. We used the intervals of less than 5 surgeries for surgeons, 6 to 10, and more than 11. For hospitals, we used the intervals less than 10, 11 to 20, and more than 21. For surgeon volume, we used these intervals because in our institution, that is how less than 5 is the amount of surgeries, amount of procedures a surgeon needs to be considered proficient in it. And this is the data accompanying that. So yeah, in conclusion, laparoscopy and robotic surgery did not result in any, did not have any significant difference in outcomes in terms of complications and perioperative health resource utilization. Hospital and surgeon volume did not impact patient outcome in this study. Thank you.